Hello friends, I wish a very happy new year, healthy and prosperous 2021, and I take this opportunity to share with you my experience of year 2020, which was fully occupied with the corona pandemic in our practices, and a whole year we had gone through the worst phase of our career, and especially our heart patients have suffered a lot during this corona pandemic. Although first 3 months were okay, January, February and March, but when first lockdown came, we never knew what is going to strike us. In this COVID-19 virus, all systems of the body were affected very badly. That includes the hemodynamic system, cardiovascular system, hematology of the patient, and of course the lungs were the primary organ to get affected. And as we gradually understood the pathology and the spread and the complications of the COVID-19 virus, we understood that it causes a lot of damage to my field of work, that is heart. It causes derangement in the clotting system. So people used to come with the acute clots in the coronary arteries. Those who already had coronary artery disease, they suffered acute myocardial infarction, their angina worsened, and they feared to come to hospital to meet us to undergo any kind of investigation because of the corona pandemic. They suffered silently, and some of them they died also. Then this infection, once it was diagnosed as a primary lung infection, it also caused infection in heart valves, which is what we call as a valve endocarditis, a native endocarditis. And if person has had a heart valve replacement done either by tissue valve, then it would cause a valve endocarditis, and a prosthetic valve by mechanical prosthesis, then valve requires to be on anticoagulation, and then they came with the clotted prosthetic valve. So these are the complications which we faced. Apart from that, people had a spate of heart failures because of the dilated cardiomyopathy and myocardium reduced functioning of the heart. That is called as dilated cardiomyopathy. Although they were treated with the anti-inflammatory medicines like tocilizumab and antiviral medications like remdesivir and steroids, despite that, some of them, at most 10% patients, had a cardiac involvement, and those with the comorbidities has had high level of morbidity and mortality. And in those 3-4 months, we had spate of cases, those who came with the coronary problems had to require rescue angioplasty or coronary bypass surgery on emergency basis for acute MI. Also, I did some of the cases where valves were damaged by endocarditis, viral endocarditis, or valves got clotted. So we have to do emergency declotting of the heart valve and replace the valve with a new prosthesis. These are some emergency operations which we carried out, and luckily, despite all these complications and comorbidities, the success was 100%. That was a take-home message, that with the good protocols and good understanding of the pathology, we could salvage all these patients, those who came with the complications during corona pandemic. And at the same time, it is important for us that our hospital has a separate operation theatre, separate ICU for these corona patients, so that it was important for us to give a good, successful outcome for all these complications of corona pandemic patients. So this year was full, almost 9 months have passed by, still some restrictions are there, and although corona infection is now receding, but I will still say that another 3 months one has to take all precautions. We have to keep social distancing, keep our masks on all the time. Do not go into crowded places. If you have any heart disease, do get your follow-up checkup done with your doctors. And now we are open, our OPDs are running normally, and at the same time we are doing now normal elective cases along with all those patients, those who have had heart disease requiring, and those who have postponed their heart surgeries, now they are coming back, and we are back to our normal routine schedule of heart surgeries. I will wish that 2021 will be better, healthier, and with all the experiences, we as doctors and you as patients will be more experienced to deal with the complications of your disease, and you will be getting better health care and better treatment with all the experience of last year. And I wish that all of you now keep all precautions, stay safe, stay healthy, and go through a new phase of healthy life. Thank you very much.